Hi friends, I'm Deba. Today we are going to talk about engorgement and give you some tips on how to handle that when that occurs. Engorgement typically happens between the 3rd to 5th day when your milk volume starts to increase. Some moms say it's my milk coming in. Really, your milk is here. It's just increasing in quantity, as well as there's some swelling fluid going on. There's also some extra rush of blood to the breast as well. So the breasts tend to be more swollen, firm. They can even be a little bit painful. And depending on how many babies you have and your milk volume, it can come in like a vengeance and be really uncomfortable. So today I want to give you some tips. Not everybody is going to need to do this ice step first. I just want to put it out there because some moms do wake up and they're extremely swollen, and so the ice, reducing the swelling with the ice is going to help before the other steps will. Now, if you wake up and your breasts are really full, tight, swollen, and uncomfortable, you might need to do a cold compress, such as an ice pack, or I really like the Lancino gel packs that you put in the freezer. You could put that onto the breast and do that for about 20 minutes. You might have to do it once or 2 times before you do this routine I'm about to tell you. And that's really for when your breasts are really swollen. For most of you, you're gonna wake up and you're gonna be a little uncomfortable. Your breasts are gonna be fuller. There might be a little swelling going on. First, you're going to put a warm, moist compress on the breast. Moist heat tends to work better than dry heat. So what I mean by that is getting a bowl of really warm water and putting some washcloths in the water, then squeezing out the washcloths, mostly still having a little bit of liquid left in the washcloth, and then putting it onto your breast. And then once you have the washcloth on your breast, then you're going to do a little breast massage where you cup your breast with one hand and then you use the finger pads of the other hand, and you're going to start little circles starting at the chest wall and then moving all around the breast to the areola, which is the brown part of your nipple. Now, it's kind of like you're doing a breast exam. You're feeling pretty deep, trying to release some of those plugged ducts that you might feel, some of those hard spots, all right? So once that washcloth gets cool, you'll want to put it back in the water, put it back on the breast, and do that for about 5 minutes or so. Heat aggravates inflammation, and that's what's happening to your breasts right now. Although the milk supply is increasing, there's also a lot of inflammation happening. So we don't want to aggravate the inflammation with the heat. So we'll just do it for 5 minutes, kind of helps to get the milk cells loose and gets the milk flowing a little bit easier. But you'll still see that your breast is still pretty firm. So then what we're going to do is a little bit of hand expression. And this hand expression is going to help you to loosen the breast tissue and get the milk flowing a little bit easier. So you'll start with your hands at the 9 and 3 o'clock on your breast. If you think of your breast like a clock dial, you'll put your fingers at the 9 and the 3 o'clock, and then you're going to push straight into the chest wall. Then you'll squeeze your fingers together and release. So it's a back, compress your fingers together, release. You'll do that at the 3 and the 9 o'clock, and then you're going to move to the 12 and the 6 o'clock and now soften up the breast tissue that's on the top and bottom of the breast as well. So you might do that for a couple minutes, loosen up the breast tissue, and then you're going to move into what's called reverse pressure softening. A lot of you, the areola is going to be very swollen, and that tends to flatten out the nipple, and then baby has a harder time latching to the breast. So if we can move away that swelling fluid, it'll allow the nipple to come out a little bit more and be easier for baby to latch. So to do reverse pressure softening, you're going to put your fingers around the base of your nipple and you're gonna push into the chest wall and hold it for about 30 seconds to a minute. You'll start to feel your areola starting to soften underneath your fingers, and then you can let go and then latch the baby to the breast. While you're feeding, if you can get your partner or if you have the hands to be able to do it, you can massage the breast while baby is feeding, as well as areas that you might feel that are tighter. Once baby is done with the feeding, so you do want to offer both breast. Once baby is done with the feeding, then you can do a cold compress for 20 minutes, about 4 times a day, and that's going to help to reduce the swelling. The cold compress is actually one of the best things you can do, besides of course removing the milk with the baby, but it is one of the best things you could do because it helps to reduce the swelling, which is what's happening to the breast. So we don't want to overdo the cold compress, so 20 minutes 4 times a day should be just fine. Now, for some of you, if you are really uncomfortable after feeding, you might need to just pump 1 time. We don't want to overdo the pumping. We don't want to tell your body to make more milk than you need, okay? So you might want to just do 1 time where you pump and you just get the breast totally empty, and then you can start afresh. But again, I want to caution not to overdo the pumping. Well, I hope these tips help, and you just let us know if you have any questions.